there, my name is Saren and I am part of 3MD, Three Mommy Doctors. I'm an emergency physician and most importantly a mommy of three. 3MD was started by three friends who trained together in residency. We subsequently now have 7 children collectively among us. We realized that the baby and the first aid kits on the market didn't have the hospital grade supplies that we as physicians use on our patients, and that many ER visits could have actually potentially been even avoided if parents had access to quick and trusted information, and that inspired the concept of 3MD. BabyStat is one of 2 kits that we have launched and is designed for babies and infants 1 year and younger. It addresses the most common newborn emergencies and contains instructionals written by emergency physicians, as well as red flags on when to go to the ER, and is divided into symptom-based categories: ouchy, yucky, and cranky. Ouchy covers rashes and fever, and these are the 2 most common, most anxiety-provoking symptoms for parents, and gives a fever medication chart that is based on weight and not age, and defines a fever, and also contains all the things that you need to tackle a fever, such as a thermometer, which can be used rectally, which is very important, especially as the most effective way to measure a temperature in babies 6 weeks and younger, as well as some lubricant to use the thermometer, medication dosage syringe for effective and exact dosing of antipyretic or fever-reducing medication. And we have also included some select homeopathic medications that have been used for centuries, time-honored medications that are put out by Boiron, a leader in homeopathic medications, that have been used for their anti-inflammatory and healing effects that are good for general rashes, as well as a very effective hospital-grade butt paste that we hospitals use for diaper rash. So the next category we have is cranky, and cranky is used to tackle teething as well as gas pain and tiredness. And cranky also contains select homeopathic medications that are actually divided into blister dosages that are very convenient and easy to use. We also have an elephant teether, which is BPA-free, latex-free, and a binky that is used in most neonatal ICUs because of the way it is shaped to avoid the nose. In addition to that, we have a half-size kimono onesie, which is used especially for newborns with the umbilical stump in mind, because you can just pull it, instead of pulling it over your child's head, you can wrap it around, and it still exposes the umbilicus for the newborn baby. And it also contains the mitts that help protect the hands from doing any damage, especially to the face and eyes. And our last category we have is yucky. Yucky is used to tackle essentially nasal congestion, and as well as cradle cap. So it contains a hospital-grade nasal bulb, in addition to the saline drops that are used for that. Babies are obligate nose breathers, and so when they have any sort of congestion or blockage in their nose, they can't quite properly feed or sleep well, which makes them miserable, and hence you, the parent, very miserable. So instructions highlighting how to properly nasal suction and get the gunk out, as well as the comb that we use to effectively remove the scales for seborrheic dermatitis or cradle cap, another very common infant ailment. And last but not least, we have also included an infant and child CPR card, which is very helpful refresher for infant and child CPR, as well as a emergency phone list that you can personalize with your own emergency contacts, and then place this for a caregiver or a babysitter. So To highlight, Babystat contains over 68 items, all BPA-free, latex-free, full-size items, hospital-grade products with doctor-written instructions and red flags on when to go to the ER. We also have some quick references such as the emergency pediatric card, CPR card, and the fever medication dosage chart that are easy to use.
So Sarah, we have a question from Isabel.
Yeah.
Do these need FDA approval?
These are already all the items in here are FDA approved, and the kit itself is also FDA cleared. So we're good on that note.
Oh, and also she asked, how do you usually detect if the baby has nasal congestion?
Nasal congestion. They will sound funny. They can't breathe. They will sound funny, and there's probably a lot of stuff already coming out of their nose. So
this kit is great. I was wondering, like, if you need to replace one of the items,
yes,
or if you use up one of the items in there. There's 68 items. Like, is there a way we can get a replacement?
Yeah, the refills are coming, but these again are all full-size items, and so most of them you will not have to replenish during the lifetime of your newborn.
That's great.
So essentially, Babystat's a perfect shower gift for new parents, and as well as parents that have already been down this crazy, wonderful adventure of parenthood. And it contains all the stuff that we would have loved as new moms, backed by the knowledge that we have as emergency physicians. Any other questions? Thanks. Any other questions? Thanks.